kalau yang orang yang buat breast filler ni, even dia punya skin changes, bila dah jadi complication kan, the skin changes tu daripada luar pun dia boleh mimic breast cancer.
Okay.
Sebab tu memang susah lah. And besides, kalau orang yang buat breast filler, bila dia buat imaging, MRI, dia tak buat mammogram, dia buat MRI.
Hello, good day everyone. Thank you for joining in once again, only on MSU Medical Center's Med Talk podcast. And I'm Vaish Arumugam.
I'm Farah.
Today we are going to be talking about something very essential, Farah. What is it?
Breast reduction.
Oh, wow. Okay.
Wait, there's more. Breast filler.
Breast filler.
And?
Breast apa?
Ooh.
Breast filler, breast reduction and? Implants.
Yes.
So, easily said, when we talk about implants and all of that, we will think about Botox. Usually that's the term. Botox je always having these myths and also different negative connotations. Tapi hari ni, we will talk better things about these and the benefits of them, why we do that, and what are these things actually for. Right. To talk about this and more, joined with us today is Dr. Muyasara.
Hi again.
Hello, hi, Doctor.
Doctor.
How are you?
Hello, Farah. Hello, Vash.
Hi, Doctor.
Doctor.
She is our plastic reconstructive and aesthetic surgeon at MSU Medical Center. So, Doctor, you look very vogue today.
Really?
Very fashionable.
Do I?
Do I? Itulah kelas kita. Hello, please. Tapi, is this what you wear to your surgeries?
Oh, this is called a scrub.
Okay.
We do wear this kind of clothes to OT.
Okay.
I have a lot of them in various colors.
Okay.
But some of them I just wear it on the outside during clinic.
Okay.
And some are made special for the OT because we can't use the same clothes that we use outside in the OT. It needs to be like a fresh.
Sebab dah biasa tengok scrub yang putih kan. Hari ni nampak scrub yang pink macam tiba-tiba macam fashion sangat. So sesuailah dengan topik kita hari ni. Sebab it is about aesthetics kan.
Yes.
So doktor, apakah itu breast implant?
Breast implant is actually a gadget. It's actually this.
Okay, kita ada kat sini.
And
Yeah.
this is the breast implant. And what's the function of it? Do you wonder?
Yes.
Can you guess?
Untuk besarkan breast.
Yes, exactly. It is what it is. It is like sort of like a filler, but it's encapsulated in a silicone capsule. So we use it to augment the breast. Untuk membesarkan payudara.
Tapi kat sini kita ada juga different topics
Yes.
kan hari ni. Sebab ada breast reconstruction and also breast filler. Bila kita sebut breast filler, breast reconstruction dan juga breast implant, adakah benda-benda ni berbeza sama satu ataupun they are the same?
Berbeza. Totally different.
Okay, can you please talk to us a bit about all of that?
Overview,
yes.
Okay. So breast implant, as you said, it is a gadget that we use to augment the breast to
Besarkan
add on-
payudara.
Besarkan payudara. Breast filler also untuk besarkan payudara.
Okay.
But it is using the method of injection. Okay. And there is a safe one, there is an unsafe one, depending on the composition. So I'll get back to that later on. The next one is apa tadi?
Reconstruction.
Breast reconstruction.
Yeah.
Breast reconstruction is bina semula payudara. Kalau dalam bahasa Melayu, you create a breast out of nothing from using a soft tissue that you take from somewhere else.
In your body?
In your body.
Oh, ya ke?
Yes.
So kita
Example.
ambil example?
Example, from your flabby tummy, from your any excess tissue from your back, from the muscle of your back, from your hips, your lumbar. It can be any tissue that has ada certain criteria lah yang kita boleh transfer to the breast area, and then kita bina semula payudara, which is usually is needed after a breast cancer removal, mastectomy.
What about breast reduction, doctor?
Breast reduction reduce is a type of surgery to reduce the volume of breast. It's antagonist of breast implant or breast augmentation.
Well, so what kind of patients who would want to reduce? Why would they? What are the reasons behind like kenapa dia nak reduce dia punya payudara dia?
There are lots of reasons. You can divide them into reconstructive reasons and also functional reason and also cosmetic reason. But I like to divide them into three. Number one, physical reason. Number two, psychological reason. Number three, for cosmetic reason. And kita elaborate sikit pasal these reasons. So for physical reason is actually because of the burden itself, the burden of the size. Sometimes they can go up to even H or X. And this physical burden can cause real physical health effect. For example, back pain, shoulder pain, neck pain, even sometimes up to the back pain. And sometimes because of the huge breast, the fold dekat inframammary fold, the bawah payudara tu, there's also skin changes, skin infections, fungi infections, also all these very uncomfortable symptoms lah, keeps on sweat and etc. So this is an example of the physical reasons. So psychological reasons is definitely because it comes with the outlook, physical outlook, how people perceive you and how obviously it affects how you socialize. So sometimes it can affect the mental health in sense of it can be bullied, being like a so-called like fat shaming, but it also can be when you say the psychological reason, including how you socialize with others, shyness, and you don't really feel comfortable when people look at you or stares at you. It affects how you converse with others, how you present yourself. And number three is the cosmetic reason, and this is usually associated with attires, like very difficult to wear clothes, very difficult to find bra sizes, difficult to get a proper size attire, and they usually complain of disproportionate when choosing their clothes or when they want to buy clothes. It become very hard for them. So these three reasons are the main one why people always seek breast reduction. It's rarely because of solely cosmetic reason, because they said breast is part of the woman, and some people they augment breast, they even fill in with implants or fillers, but some reduce. And as compared to breast implant, where it usually is associated with more on cosmetic reason, but breast reduction is more on functional reason.
Doctor would have definitely had a lot of patients kat MSU. So what is the biggest common cause penyebab yang patient-patient datang jumpa doktor dekat MSU untuk dapatkan pembesaran payudara ke ataupun pengecilan ke, implant ke ataupun bina balik ke? What is the biggest faktor yang besar untuk patient datang jumpa doktor kat sini?
The biggest factor is most women, they just want to feel comfortable in themselves, in their own skin. So, and this varies, from one person to another. Some people, they accept their body changes, especially, for example, changes after post-pregnancy, changes after massive weight loss, or even, in some cases, changes after puberty in case of breast reduction. Some people, they are able to cope up and they have a very positive outlook, and they can carry themselves well, and it's not an issue for them. But some, they just don't feel comfortable in terms of the reasons that I mentioned just now lah. Macam dia punya physical reason, dia punya cosmetic reason, and the reasons are a lot. But the main reason is for you to be comfortable with yourself. And what affects this? Apa yang affect this comfortable? It varies factors. The size, how you your job. For example, having a huge breast maybe is a good thing for those who, for example, like is a plus size models ke apa, but it may not be strategic in sportswomen. You see, so there are various reasons. So as long as they want to be comfortable in their own self, not just in their own skin, but as a daily life. That's actually the major reason why.
Okay, doktor, I want to go back to the breast implants. Apa jenis-jenis breast implants yang ada? Yang kiranya yang what type? Berapa banyak jenis ada? Does it vary from dia punya ingredients ke? Dia punya like doktor cakap ada casing dia ke? So, doktor describe.
Okay. Ada banyak jenis, and I would mention brands lah. But the main thing is 2 types in terms of composition. Ada saline implant, ada silicone implant. So saline implant is basically water. But still it is encased in a silicone capsule. This is what protects the material inside the implant. It's similar dengan silicone implant. Silicone, dalam dia ada silicone, and then it is capsulated inside another silicone capsule. Tapi dia punya jenis silicone tu, how it being processed is different lah. So that is in terms of composition. In terms of shape, there is round, there is anatomical.
Okay.
So anatomical ni dia lebih menghampiri bentuk payudara yang asli, sort of lah. Manakala yang round ialah bulat lah macam ni, this is round. And then dia ada texture dia. Ada jenis implant yang smooth, macam this is smooth. Ada jenis implant yang textured. Tapi sekarang textured dah ada banyak yang callback, ada yang micro textured.
Ada any risk that it will burst dalam badan tu, doktor?
Rupture of implant. Okay. There is small percentage of rupture of implant. Cuma as compared of teknologi silicone implant yang sejak daripada zaman 60-an dulu, the technology now dia lebih canggih lah. Maksudnya kalau dia rupture, dia tak adalah rupture dan masuk ke dalam tisu-tisu semua tu. Dia lebih control rupture. Maksudnya bila kita nak buang tu, dia berlainan dengan filler. Yang kita dengar filler, silicone filler semua tu lain. So nak kata ada serius untuk rupture? Ada.
Dan juga bila kita dengar tentang breast implant ke especially di kalangan warga yang tak banyak aware about this kan, ada banyak konotasi negatif terhadap benda-benda macam ni. So apakah konotasi yang paling common dan macam mana menghadapi konotasi macam ni?
The stigma with breast implant and breast augmentation is always, why not you terima diri seadanya. But you have to terima diri you seadanya, and of course you have to be grateful. But we come in various shape and size, and we go back to the reason why people seek breast augmentation. There are many reasons. Cosmetic is just part of the reasons. For example, dia guna juga di dalam breast reconstruction pun ada juga menggunakan breast implant. And then some people yang memang born with very small breast, which is they fall out of normal demographic, and then those yang memang tak ada langsung breast since born, and those yang mengalami perubahan bentuk badan selepas pregnancy, some of them dia punya breast shrink, and also those yang lost dia punya breast volume after massive weight loss. This is not considered, to me, this is obviously my own personal opinion lah. For me, this is considered as a change, which is deviate from something which is common. So even though you can live with it, but like I said just now, different people have different kind of response, different kind of penerimaan. So when it comes to that, that's where this comes in to help them. To me, this is so much better than those things yang offer secara tak betul, rawatan-rawatan yang tidak berapa betul yang di luar sana. So what the medical field offer is something that comes with real results, and also relatively much safer than apa yang di offer di luar sana for gullible.
Nak juga tanya doktor, apakah risiko komplikasi bila somebody attempts for breast implant? Sebab ada mitos where they say that breast implants especially paling safe, paling selamat. Adakah itu betul ataupun ada tensi untuk risiko komplikasi?
When it comes to breast augmentation, it is a surgery. When it's a surgery, dia invasive. So apa-apa rawatan yang invasive ada risiko. That is why you have to go to the proper person and do it at the proper place, a controlled place.
Macam MSC.
Ya. Nak iklan pula. Okay. But risiko untuk breast implant ada. Cuma nak dikatakan tak adalah risiko sampai membahayakan nyawa. That's very rare lah. Anything can happen in medical world. But nak dikatakan pembedahan breast augmentation dengan menggunakan breast implant ni is considered quite a low risk surgery. Provided patient sendiri, patient factor pun low risk lah.
Dan doktor, kalau siapa yang ada breast implant ni kat dalam ni, when they breastfeed, can they still breastfeed ataupun
Yes,
dah?
they can.
She jumped the gun. I was about to ask that question. She read my mind.
Yes, they can.
Yes, they can.
Yes,
So
they
dia tak mengganggu apa-apa untuk ni lah, untuk ibu yang nak menyusukan.
Yang menyusukan, dia tak sepatutnya mengganggu breastfeeding because dia punya insertion of implant, kita tidak destroy apa-apa breast tissue. Dia ada plane dia yang sepatutnya. Yang akan mengganggu breastfeeding is more on a breast reduction.
Yes.
Because kita mengganggu tisu payudara, kita buang tisu payudara, jadi definitely akan affect breastfeeding. Bagaimanapun, how bad or how severe the effect the breastfeeding pun kita tak boleh nak lump sum because different people different lah.
Very subjective. Tapi untuk seorang wanita yang nak reduce, nak mengkecilkan payudara dia, kalau dia nak kahwin, nak ada anak nanti, dia nak menyusu secara natural, adakah benda tu memang mustahil ataupun dengan teknologi kita zaman sekarang ni, benda tu boleh juga?
Dan juga saya nak tambah juga doktor, like also bila seorang perempuan mengandung kan, their breast tend to get bigger kan, because of their hormone and everything. Boleh dia besar balik? Mungkin tak macam asal balik, but can it be bigger than what?
Yes, it
Boleh.
can. Dia kalau because our body, the changes with our environment, our hormone and our age. So even though kita dah kecilkan, let's say we gain weight, it can be bigger because breast tissue composed of not only just breast tissue, dia not just breast glandula, but it also composed of fat. So naturally, if you gain weight, the breast will be bigger. The same as macam pregnancy changes. Pregnancy changes will affect on the breast juga.
Bila kita kata technology advancement kan, how far have we come with our facilities, especially dekat probably MSU Medical Center juga, and okay, takkanlah kita nak kata tak ada risiko langsung, tapi macam mana doktor akan bagi confidence kepada para penonton kita if anyone is thinking about this?
Number one, the person yang buat the procedure, it must be a qualified plastic surgeon. Kalau macam kat Malaysia, it needs to be licensed dengan Malaysian Medical Council. Dia perlukan pakar berdaftar di bawah National Register Malaysia, specialist National Specialist Register. Dan yang ketiga, dia memerlukan credentialing and privileging LCP lah. Chapter 3. Okay, 3 benda ni perlu ada bagi seseorang untuk buat menjalankan prosedur breast implant ini di Malaysia. Number 2, in terms of the facilities, kena in the accredited hospital yang mempunyai operation theatre, peralatan yang sterile, pasukan yang lengkap, Dr. Bius yang bertauliah, to make sure that everything is being done in the lowest risk as possible. With the technology adalah kita punya vital signs monitoring, macam mana nak bagi bius, peralatan-peralatan yang canggih untuk operation, semua itu adalah the progression of technology lah.
While still talking about facilities kan, saya nak tanya, adakah benda ni yang apa nak saya sebutkan ni kejap ni, adakah ini mitos ataupun memang berfakta, iaitu breast implant boleh menyebabkan interference ataupun gangguan dengan mamogram?
Bila kita pakai breast implant, we need to tell our radiologist semasa membuatkan mammogram tu bahawa kita ada mammogram, kita ada breast implant, because interpretation memerlukan kepakaran yang aware dengan keberadaan breast implant ini di dalam sesuatu wanita. So but it's not like breast filler yang mana kita tak boleh nak differentiate. Adakah itu cancer, adakah itu implant. Kalau yang kita guna breast implant biasa boleh differentiate. Okay? Tapi kalau kita guna yang breast filler yang you see so many kan kat dalam sock mat kan, inject sana sini yang murah-murah semua tu. That one is going to be very hard to differentiate whether it's cancer, whether it's filler, because they mimic each other, because it's a foreign body. So menjawab mitos tu, kalau breast implant boleh differentiate, dengan syarat radiologist tu is trained untuk interpret. Tapi kalau breast filler memang susah nak differentiate.
So kalau lah saya pergi ambil breast filler katanya lah, for an example, and I nak juga pergi detect, just to check for breast cancer, potential breast cancer in the future. Dan saya tahu risiko ni, tapi saya ada breast filler juga. Adakah ia akan menyebabkan saya jadi, fall under the category yang tak boleh detect breast cancer langsung, just because for whatever solid reason saya ada breast filler? Ke saya masih boleh detect?
Very hard to detect, because kalau orang yang buat breast filler ni, even dia punya skin changes, bila dah jadi complication kan, the skin changes tu daripada luar pun dia boleh mimic breast cancer.
Okay.
Sebab tu memang susah lah. And besides, kalau orang yang buat breast filler, bila dia buat imaging, MRI, dia tak buat mammogram, dia buat MRI, dia punya filler tu merata-rata, the whole breast. Dia lain dengan breast cancer. Breast cancer dia more on focal, melainkan dia ada multifocal, yang jadi multifocal. But most of the time dia ada satu lump dekat situ yang dia mengatakan itu adalah seperti breast cancer. Tetapi kalau dengan adanya breast filler, all those things yang merata-rata tu dah obscure. If there is ada breast cancer pun dah obscure the changes. So
tak nampak sangat
very
lah
hard to differentiate. Very hard tu.
So it's good to know tentang bahaya-bahaya ataupun risiko di sebalik procedure breast filler sebelum kita opt for such options, kan? It's
And
good
actually,
to know.
Vash, breast filler is actually not permitted.
Okay.
It's actually not a conventional treatment.
Kat Malaysia je ke ataupun kat mana-mana di
Around
dunia?
the world, in the
Okay.
medical fraternity. Breast filler ni, mostly yang buat is not by regulated medical practitioner.
Okay.
It's unregulated. We call them the travelling healer, and this has been done memang since dia macam skim cepat kaya. Skim cepat kaya kan daripada tahun daripada
purple
awal
paleolithic lah
zaman
tu.
kan ada dokumentari tu. It's the same as these fillers. It's here to stay and it will stay. But you have to be aware of it, not to be terjebak lah.
Okay. Doctor, with implants, ada scarring pada...
Yes.
Yes.
Yes. There is a scarring by in plastic surgery. Scarring ni kita letak dekat a strategic placement of scar. For example, in breast implant, the scarring can be underneath the breast fold, yang mana tak nampak lah basically. It can be around the nipple areola complex. It can also be at the armpit. Mengikut kepada teknik lah. But scarring, yes. If not, macam nak masukkan implant tu. Cuma dia punya scarring tu is very strategic lah.
Tapi kalau saya nak cover that up, boleh tak saya also opt for reconstructive surgery ke ataupun any aesthetic surgery ke untuk cover that up?
Not really cover, but more on improving the scar. There are lots of treatment lah untuk scar.
Let's talk about MSU Medical Center, shall we, Farah?
Yeah.
So, when a patient comes to MSU Medical Center for any of these rawatan filler ke, reconstruction, reduction ke, untuk memperbesarkan ke, what are the procedures that they have to go through? Bila doktor nanti buat investigation on them, kalau dia ni layak ke tak untuk dapat ni, what are the things that you see in them?
Number one, of course, the patient needs to be fit for the operation. So, fit in sense of what? In sense of age, in sense of comorbids, adakah dia ada mempunyai penyakit kronik ataupun yang tidak berbaloi. Sebab you have to understand, this is an elective procedure. Even if you tak buat, dia bukanlah membahayakan nyawa. So if the risk is more than the benefit, then definitely it's not a good candidate. If the benefit is more than the risk, it's a good candidate. And again, I want to beritahu you, breast filler we don't offer. But there is a type of breast filler that we can offer.
Okay.
The only one is filler using fat graft.
Okay.
You take our own fat, you process it, and then you transfer into the breast. That is okay for a breast filler, autologous breast filler.
Maksudnya gunakan tisu dengan kulit badan kita sendirilah.
Yeah, fat tissue.
Fat tissue saja. Okay.
But with that type of filler, doktor, adakah bila katalah patient tu dia dah dia go on a diet dan weight dia tu dia turun?
Yes.
It will
affect.
It will affect.
Because it will affect the fat that we transferred the same way it affect the fat all in all the whole body lah. So kita diet, our fat cells will shrink. If we don't control our diet and so on, our fat cells will hypertrophy, dia akan berbesar. So it fluctuates with the diet, and we have to understand that in a fat transfer, bila kita transfer fat tu, not 100% akan stay. Because and ada beberapa persen akan resorb, maksudnya hilang lah. But usually it's about 30% lah standard.
So with all these procedures, doktor, implants, breast reduction and all yang kita bercakap tadi semua, ada maintenance tak? Kiranya macam like contohnya macam bila dah doktor masuk ke implant, ada maintenance, adakah dia kena pergi check up ke, adakah macam maybe in about 2 years maybe dah shrink ke dan ni ke, what is the type of maintenance to all of this? Yes.
The follow up untuk breast augmentation usually 1 year. Why 1 year? Not really because dia akan baik 1 year, but the final result is always usually after 1 year because how our body accommodate the implant semua tu lah. So 1 year. But after that, we don't really follow up. The maintenance is nothing much to maintain actually. You just have to be aware that if you want a revision, that is when you go back to your doctor, nak ubah or nak baiki to something better. Because breast implant ni, walaupun kita letak, but we are not dolls, So our body age as normal. Our body changes as we age. Our surrounding and it affect lah the breast implant and the breast as a total. So the good thing is using a breast implant, it is very much reversible and you can have multiple revisions. Dia bukan macam breast filler yang irreversible. In breast filler, once you inject, what I mean is breast filler not using your fat lah. Breast filler yang using other foreign body materials, yang unknown materials, is irreversible. I would call it damage. It's not even contour because it ends up with a damaged breast and it's irreversible. And usually kalau you nak buang, you have to buang the whole breast. Mastectomy. You treat it macam ala-ala macam breast cancer. So in terms of maintenance yang kata breast implant, not much lah.
Selepas pembedahan misal kata, adakah apa-apa alangan ataupun limitasi untuk seseorang yang dah go through the pembedahan tu, for instance tak boleh fly in the flight ke, ataupun cannot go hiking ke, cannot go into the ocean ke, adakah benda-benda macam tu ataupun iaitu hanya mitos sahaja?
Definitely mitos lah. It's actually definitely mitos, but in some implants, ada jenis-jenis implant yang mana you have to aware kalau kita swimming, nanti bila keluar tu kita rasa sejuk daripada normal. Okay. But it's nothing membahayakan lah. It's more of changes lah yang you rasa different.
Nanti you akan biasakan diri lah kan.
I know you cakap pasal yang rupture implant naik aeroplane kan. It's actually a myth.
It's a myth kan.
It happen, but it's not because the implant tu boleh rupture in the plane it's not because of the plane itself, it's not because of the flight. It's most likely implant tu memang dah ada impending rupture. Maksudnya memang tunggu masa je, and kebetulan dia masa tu kat flight. And then bila flight dia ada pressure ke apa, and somehow it happen. But in normal cases tak lah.
Apakah proses pemulihan selepas pembedahan?
Number 1 is wound healing. Kita nak luka pulih. Number 2, lepas luka pulih, pemulihan untuk scar, parut. Dan number 3 is the contouring, the over contouring, which is that one takes about 1 year lah.
Oh,
very interesting, doctor.
That is just breast implant. Pada lain-lain tu belum lagi.
Ya, betul. Ada filler, tapi filler kita dah cover juga. Ada reconstruction, ada reduction. Ya, benda ni macam ocean lah, seumpama ocean, macam laut kan. So kita ada, kalau the more we dig, the more we learn. So itu dia Farah. Thank you so much, doctor, for joining us today. It was very informative. Yes, thank you.
So Vesh,
Anything?
Nah, I just learnt a lot. Quite overwhelming.
It has been 30 minutes, yeah?
Yeah.
Wow. I thought it was only 10 minutes.
Tengok tu, you betul. It was very fascinating. Tapi itu dia. We cover very interesting but informative topics on our episodes just on MSU Medical Centre's Med Talk podcast. So with that, stay tuned for more upcoming informative episodes. And like, share, and subscribe to all MSU Medical Center social media platforms. And with that, see you yet again on another episode, caring
Healing.
Educating.
and educating. See you all.
Bye.